couple years ago, there was like a tree that went.
Well, you got shoulder pain. We're on your side with what could be the issue. Maybe it's a rotator cuff tear. Dr. Daryl Dykes with Shelby Baptist Medical Center and the Alabama Bone and Joint Clinic is in studio to help us out. How you doing, Doc?
I'm doing fine.
I've got a bad shoulder. What could that possibly mean? What's a rotator cuff tear?
Rotator cuff tears are very, very common. It happens to pretty much all age groups to some degree. The younger people, it's usually sporting injuries. As you get a little older, the cuff is getting beat up. There's a bone on the top of your shoulder. It's over the ball of your shoulder. It's a relatively narrow space, and the tendon just gets beat up over the years.
Yeah, so they can be, you can injure it immediately, right, with something, but usually these are things that happen over time, is what you're saying? Or
the vast majority of people, it's kind of over time. It's just wear and tear.
Right.
The symptoms usually are trying to use your arm with your arm out in space, especially with a load, like say a milk jug.
Right.
And you got it out in space, putting a lot of load on your rotator cuff, and it hurts.
Would you know it immediately from that pain? You know something was wrong, but you may not know what is wrong with it.
It's usually not a sudden injury. It's a wear and tear thing, and it just builds up over the years. So if you're having pain with your arm out in space when you're trying to use it, there's a very good chance you have something going on with the cuff.
Certain movements I can do. Bench press is fine, but if I do something shoulder-wise outside, I have issues with that. What can be done to help that out?
That's fairly classic, what you just described. Most people do pretty well with their arms in close to their side. And when the arms are out away from your body, that's when it's usually a problem. Usually the first thing is get an x-ray.
Right.
Most people, you try to do non-surgical stuff, injections, anti-inflammatories, some physical therapy.
Right.
Can be very effective for most people.
That takes time though, does it not? It's not something that fixes itself overnight. It usually takes a little while.
Usually not. Usually once you do the steroid injection, you want to give it several weeks to take effect.
Right.
If you're not getting better, then we usually do an MRI looking at the cuff. As you get a little bit older, you have a greater likelihood that the tear is a partial tear.
Right.
And if you're continuing to have problems, I'd encourage people to kind of be a little more aggressive, because if you deal with it early on before it actually tears, it tends to be a much easier thing to deal with.
You're telling me I'm too late for that, but I do need to get it fixed. I appreciate it. Dr. Daryl Dykes, so thanks so much for talking about the rotator cuff.
You're very welcome.
Tear. We appreciate it so much.
You're very welcome.
And we're going to be talking about plenty of more news coming up right here on WBRC Fox 6 News at noon. Stay with us.